Dr. Mandell here with you, and I need you to stop whatever you are doing right now. Put the phone down for a second. Close whatever tab you have open, because what I am about to share with you in the next few minutes is something that most people will scroll right past, dismiss in the first 10 seconds, and then spend the rest of their lives wishing they had paid attention to. I am going to show you a technique, a simple, free, 2-minute technique that you can do right now using nothing but your thumb, no equipment, no medication, no doctor's visit, just your hand. And the results that people experience when they do this correctly are so immediate, so tangible, and so genuinely surprising that I have had patients call me afterward just to tell me what they felt. So if you have ever dealt with sinus pressure, brain fog, fatigue, sluggish thyroid symptoms, low energy, difficulty breathing, clearly, or that feeling of just being disconnected from yourself, I want you to stay with me through every single second of this video. Because what I am about to show you works through one of the most powerful and most overlooked glands in the entire human body. And most people have no idea it can be accessed from the outside of your hand. This is hand reflexology. And before anyone rolls their eyes and keeps scrolling, I want you to understand something. Reflexology is not a trend. It is not a wellness fad. It is a practice rooted in the understanding that specific points on your hands and feet correspond directly to specific organs, glands, and systems inside your body. Thousands of years of traditional medicine and a growing body of modern research support this connection. The nervous system pathways are real. The reflex points are documented. And what happens when you stimulate them correctly is something you are going to feel for yourself before this video is even finished. So let me tell you exactly what we are working with today. And I want you to really listen to this part, because understanding the why is going to make the how so much more powerful when you actually do it. Deep inside your skull, nestled in a small bony pocket just above your sphenoidal sinuses, sits one of the most extraordinary structures in the entire human body. It is called the pituitary gland, anterior and posterior, 2 lobes, one tiny structure. And it is the size of a pea, a single pea. Something that small is the master conductor of your entire hormonal orchestra. Think about that for a moment. The gland responsible for regulating some of the most critical chemical processes in your body, processes that affect your energy, your metabolism, your growth, your mood, your immune function, your reproductive health, and your ability to respond to stress, is no bigger than a small garden pea sitting quietly in the center of your head. Now, here is what makes the location of this gland so important to what we are doing today. The pituitary gland sits directly above the sphenoidal sinuses, and those sinuses are connected to a whole network of other sinus cavities. Your frontal sinus at the top of your forehead, your ethmoidal sinuses between your eyes, your maxillary sinuses in your cheekbones, all of them interconnected, all of them in direct anatomical relationship with the pituitary gland sitting above them. This is why when you stimulate the pituitary reflex point on your thumb, many people feel the response first in their nasal and sinus region. The anatomy tells the whole story. The connections are real and they run deep. Now let me explain what the pituitary gland actually does, because this is where it gets truly remarkable and where I need you to pay very close attention. The pituitary gland is what we call the master gland of the endocrine system. Its primary job is to secrete hormones that travel through your bloodstream and communicate with what are called target glands throughout your body. It excites them, it stimulates them, it tells them when to work harder and when to pull back. Without proper signaling from the pituitary gland, your target glands lose their direction. They become sluggish, underactive, and your body begins to suffer the consequences in ways that can feel overwhelming and completely mysterious if you do not know what you are looking for. Let me give you a specific example that affects an enormous number of people watching this right now. One of the key hormones secreted by the anterior pituitary gland is called thyroid stimulating hormone, TSH. And as the name tells you, its job is to stimulate the thyroid gland. The thyroid sits in your neck and it controls your metabolism, your energy production, your body temperature regulation, your heart rate, and so much more. When the pituitary gland is not communicating optimally, TSH production can drop. The thyroid does not receive the signal it needs. And the result is what millions and millions of people are living with every single day, without fully understanding why they feel the way they do. There are an estimated millions of people around the world who are experiencing symptoms of hypothyroidism right now. Fatigue that sleep does not fix. A tiredness that follows you from the moment you wake up to the moment you fall back into bed. A lack of energy that makes even simple daily tasks feel like they require enormous effort. Unexplained weight gain despite not changing your diet. A mental slowness. A fogginess, a difficulty concentrating that people often brush off as just getting older or just being stressed. Cold hands and feet, dry skin, hair that is thinning, a voice that feels heavier somehow, and an overall sense of just not feeling like yourself anymore. Now here's what I want you to really absorb. Many of these people have had their thyroid levels tested and been told their numbers are within normal range. But the pituitary communication pathway is sluggish. The signal is weak, and the downstream effects are very real even when the standard tests do not fully capture them. This technique addresses that upstream signal. It works at the source, at the master gland itself, and this is where your thumb comes in. In hand reflexology, the center pad of your thumb corresponds directly to the pituitary gland. This is one of the most well-documented and consistently responsive reflex points on the hand. When you stimulate this point correctly, you are sending a direct energetic signal through the nervous system pathways to the pituitary gland itself. You are waking it up, encouraging it, reminding it to do its job with greater efficiency and greater output. And the response that people feel when they do this is often immediate and genuinely astonishing. So here's exactly what I want you to do. Do this with me right now. Please do not just watch, actually do it as we go through it together, because the experience of feeling this work in real time is worth more than any description I can give you. We are going to do this in two phases, and together they take less than 2 minutes. That is all. Less than 2 minutes of your time could be the beginning of a genuine shift in how you feel every single day. So let us begin. Phase 1. Hold up your dominant hand and look at your thumb. Right in the center of the pad of your thumb, the fleshy part on the front, there is a reflex point that sits directly over the pituitary gland correspondence. Take your index finger and your thumb from your opposite hand and place them on either side of that center thumb pad. Not on the nail, not on the joint, right in the soft center of the pad. Now I want you to pinch. Pinch both sides firmly, hard enough that you feel the pressure but not so hard that you cause pain. Just firm, deliberate pressure. Pinch it together, hold for a moment, and release. Pinch and release, back and forth. Firm pressure, pinch and release. Keep going. You are going to do this for 20 seconds. Keep pinching back and forth. Nice firm pressure each time. Some of you are already feeling something, a tingling, a subtle shift, a pressure or sensation beginning to build somewhere in your nasal area or behind your eyes or deep in your sinus region. That is your body responding. That is the reflex pathway activating. Keep going, keep pinching, back and forth. You are almost at 20 seconds. Keep it up. Now stop. Stay with me for phase 2 because this is where things get truly interesting. Take those same 2 fingers, your index finger and thumb from the opposite hand, and this time I want you to move them to the sides of the nail bed on your thumb. Not pinching the pad this time, the sides of the nail, right along the edges where the skin meets the nail on both sides. Position your fingers there and squeeze. Squeeze those 2 sides gently but with firm, steady pressure. And now, simply hold. Do not pump. Do not move. Just hold that point with consistent, gentle pressure. You are going to hold. This for anywhere between 30 seconds and a full minute. Just breathe naturally and hold. Right now, as I hold this point, I want to tell you exactly what I am personally feeling. I am feeling changes beginning behind my nasal area, a gentle opening sensation, like something that was slightly compressed is beginning to ease and expand. I can feel my sinuses responding. My breathing feels cleaner, more open, more free. There is a pressure that has been sitting quietly in my sinus area that I can feel slowly beginning to release. This is the pituitary gland reflex being stimulated directly. This is the master gland receiving a signal right now. And what is happening inside my nasal and sinus region is the anatomical evidence that the pathway is working exactly the way it is supposed to work. Keep holding your point, keep breathing, and pay attention to what your own body is telling you right now, because here is what different people experience at this stage. And I want you to know that all of it is valid and all of it is your body responding in its own unique way. Some of you are going to feel that same sinus opening that I described, a gentle easing of pressure in the nasal passages, a cleaner, freer quality to each breath, like someone quietly opened a window in a room that had been slightly stuffy. Some of you are going to feel a surge of energy, not a dramatic jolt, but a warmth, a gentle lift, a sense of wakefulness that was not quite there before you started. Some of you are going to experience clarity, mental clarity, that fog that sits behind your eyes and makes everything feel slightly slow and heavy, beginning to lift, thoughts coming more easily, focus sharpening, a sense of being more present, more awake, more connected to the moment you are actually in. Some of you will feel that you can breathe more deeply and more easily than you could 60 seconds ago. Some will feel a warmth spreading through their face or behind their forehead. Some will feel emotional, a sense of release, a letting go of tension they did not even fully realize they were holding. And most of you, regardless of whatever else you experience, will notice some kind of shift in your nasal and sinus region, because the anatomy is undeniable. The pituitary sits above those sinuses. Stimulate the gland and the sinuses respond. Every time, keep holding that point if you are still going. Breathe. Let your body do what it knows how to do. Now here is something I want to address directly and honestly, because I know some of you are going to try this and feel very little on the first attempt. And I do not want you to walk away disappointed or dismissive, because that would mean missing out on something that could genuinely benefit your health over time. The body is not always immediately responsive. Some people have spent years, even decades, with suppressed pituitary communication, chronic stress, poor sleep, nutritional deficiencies, environmental toxins, medications. All of these things can dampen the sensitivity of these reflex pathways over time. And just like a muscle that has not been used properly in a long time, the pathway sometimes needs repeated stimulation before it wakes up fully and begins responding the way it is capable of responding. So if you felt very little or nothing at all today, please hear me when I say this. Do not give up. Try it again this afternoon. Try it again tomorrow morning when you first wake up. Try it several times over the course of the next week. Pay attention each time to any subtle shifts, any small changes in how you feel during or after, because the body responds to consistency. It rewards the people who show up for it repeatedly with patience and with faith. And I genuinely expect that with regular practice, you are going to begin noticing changes that affect your daily life in ways that matter deeply to you. Wonderful changes in your energy levels, improvements in how clearly and freely you breathe, relief from that chronic sinus pressure that so many people have learned to just live with because they thought nothing could be done about it. Greater mental clarity, a sharpness of thought and focus that affects your work, your relationships, your quality of life, your sense of who you are, and how fully you are able to show up each day. And for those of you who have been living with the heavy dragging symptoms of sluggish thyroid function, I want you to pay especially close attention to how you feel in the days and weeks following consistent practice of this technique. Because stimulating the pituitary pathway means sending a stronger, cleaner signal downstream to the thyroid gland itself. And the difference that can make in how you feel from morning to evening is something I have watched transform the daily lives of people who were desperate for relief and had run out of other options. Your health is extraordinary. Your body is extraordinary. And the fact that you can influence your own hormonal communication pathways with nothing but the pressure of your own fingers is one of the most empowering things I know how to share with you. This is what I have dedicated my life to. Not complicated solutions, not expensive interventions, but teaching people that the tools for healing are often already in their hands, quite literally. Now, before I let you go, I want to talk about why sharing this matters so much. Think right now about someone in your life who is exhausted, who is struggling with sinus issues or thyroid problems or low energy or brain fog, a parent, a sibling, a friend, a partner, a colleague who mentioned last week that they have been feeling off and cannot figure out why. That person needs to see this video, and the only way they are going to see it is if you share it. YouTube does not show videos like this to everyone who needs them automatically. It shows them to people whose connections chose to pass them along. You sharing this video on your social media right now could put this information in front of someone whose life it genuinely changes. Someone who has been suffering quietly and does not have to be. Please take 5 seconds and share this. It costs you nothing, and it could mean everything to someone else. And I want to hear from you right now. Leave a comment below and tell me what you felt when you tried this technique. Did you feel your sinuses shift? Did you notice a change in your energy or your clarity? Did you feel warmth or tingling or pressure release? Tell me. Your experience matters to this community and to me personally. And if you are watching this channel for the first time, please subscribe right now and hit that notification bell. Because every single week I am here bringing you techniques, insights, and health information that your doctor may never have time to share with you in a 15-minute appointment. Techniques that are simple, natural, and grounded in an understanding of how the human body actually works. You deserve to know these things. You deserve to feel well. And I am going to keep showing up here every single week to make sure you have every tool you need to make that happen. I am Dr. Alan Mandell. Take care of that incredible body of yours. And most important, make it a great day.